8, 9, 10.
Wait, it's
We're there.
still,
We're there. It's there.
gotcha.
Okay, thank you. Good afternoon. This is the Public Health Minority Health Disparities Subcommittee of the House Health Committee. It's February 24th, 2026. We are going to discuss three bills today. We'll start with HB 625, which we actually deliberated and voted out of committee last week. We want to revisit that one. Then we will do House Bill 213, and then, I'm sorry, correct that. House Bill 625, then House Bill 178, and then House Bill 181. And if we have, if the sponsors have a difficult time getting here, we may go in a different order. So Chris, can you please go over where we are and what we did with House Bill 625, just to remind everybody?
Sure. So this bill, again, it required the Department of Agriculture instead of the Department of Health to collect already required contributions from specified research facilities. As a result, the Secretary of Agriculture, instead of the Secretary of Health, must distribute the monies collected to the Human Relevant Research Fund, administered by the Maryland Technology Development Corporation, TEDCO. The research facility is required to make the contribution, and the applicable payment amounts are unchanged by the bill. Likewise, existing civil penalty provisions continue to apply to research facilities that fail to pay the contribution. The cross files hearing is this week. And last week we passed this favorable. 4 in the yay, 0 in the nay, 1 abstention. And we have it back again
Okay,
from the
thank you.
chair.
Thank you. And I think actually, I'm not sure there was a nay. I think Delegate Riley was absent when we took the vote.
Mhm,
Delegate Hutchinson abstained.
mhm.
And what we wanted to do is just give an opportunity to revisit and see if there are any concerns or questions that perhaps we were moving too fast to look at. So I'm going to open the bill up to the members for discussion and for reconsideration. And so I guess I'm going to go to Delegate Hutchinson or Riley. Delegate Hutchinson, did you have any questions that we should address that may or may not change your mind, or you feel like you understand the bill and you understand, and and you're
No, I
satisfied?
still need a little bit of help on it because I do know that Maryland Right to Life came, testified and unfavorable about the bill. I heard that somehow this involves stem cell research in it. I don't know whether that's true or not. So I need a little help on that.
Okay. Chris, are you able to go through the bill a little bit in a little bit more detail?
You know.
I'm sorry, Delegate Hutchinson, it was breaking up a little bit for me when you were talking. Could you
He's,
repeat your question?
I think he said he wanted to know about whether stem cell research or how it's impacted in this bill. Um, and if
Yeah.
if you're able to address that.
Yeah, 1 second. Hmm.
So I'll wait a second while Chris is getting his notes. I'll go ahead and talk. The facilities that we're dealing with, if you look at page 2 of the bill, right? We're talking about research facilities that are already in existence. Okay, and we're essentially based on the size or the number of animals that they
No, I'm doing a
process,
subcommittee hearing here, but I'm good, thanks.
right? Where Delegate Coffin, just so you know, you were unmuted. Um, and they're being charged a fee, and that creates this fund. And the fund is designed for human relevant research. And my understanding is that this is being created to help us to continue the important life-saving research that we're concerned shifting in federal dollars and withdrawal federal dollars for research may affect. The bill is not specific, as I understand it, about the type of research or about whether stem cell research is or is not involved. And I don't remember any testimony about stem cell research other than that we frequently have opposition to any adjacent legislation that the right to life opposition thinks could possibly be used too. But it is, as far as I can see, it's silent about the specifics of the research.
And if I can add, Madam Chair, obviously I'm not a scientist and I didn't choose that field of study, but it does says, the fiscal note, excuse me, says to promote state-funded research intended to develop human relevant alternatives to using non-human animals and, whatever testing. So I do not know personally other types of research that, that doesn't use stem cells, human stem cells, but I'm assuming there are more than just that. And this bill isn't, like the chair said, specific enough to really mandate the use of stem cells.
Okay. And I don't think we have anyone to speak authoritatively on the bill. But let me just share, I'll give you the source here, from Justia Law, talking about, I asked what about stem cells in Maryland, and we can go to Maryland statutes, economic development, Division 2, independent regional development units, etc. Title 10, Subtitle 4, Part 3, stem cell research. So this is about Maryland, our statutes now. A person who conducts state-funded stem cell research shall conduct the research in a manner that considers the ethical and medical implications of the research. A person who conducts state-funded stem cell research may not engage in any research that intentionally or directly leads to human cloning. Then we go on to Title 10, Subtitle 4. A healthcare practitioner licensed under the Health Occupations article who treats individuals for infertility, and it talks about providing individuals with information sufficient to enable them to make an informed and voluntary decision. And that provide individuals, present the individual with the options of storing or discarding any unused material, donating any unused material for clinical purposes in the treatment of infertility, except as provided in subsection B of this section, donating any unused materials for research purposes, and donating unused material for adoption purposes. Any unused material donated by the state-funded stem cell research may not be an oocyte, which means it may not be an egg. Okay? And an individual who donates any unused material for research purposes under subsection A2 of this section shall provide the healthcare practitioner with written consent for a donation. So I think that if there are concerns about stem cell research, and then, I'm sorry, let me continue on to Subtitle 4, Part 3, stem cell research. A person may not purchase, sell, transfer, obtain any material donated in accordance with 10.438 of this subtitle for valuable consideration. A person may not give valuable consideration to another to encourage the production of material donated in accordance with 10-438 of this subtitle for the sole purpose of medical research. And a person who violates this section is guilty of a misdemeanor on conviction. So we're not affecting current law. And so I guess the question that I would suggest you may want to consider is if your issue is with this bill or with current law. And if you feel that current law, as I've read again, this is Maryland Economic Development, Division 2, Title 10, Subtitle 4, that we're not changing that. So whatever the standards are for stem cell research on, February 24, 2026 would not be different after this bill moves forward. All that would change is they'd have a funding source that does not rely on the federal government. Is that helpful at all?
What was the last part you said?
The only change would be that there would be a funding source that doesn't depend on federal government funds, because it's the federal government funds which are being drawn back. So we would be able to continue the research that we have been doing. Any other questions? Teresa, I'm sorry, Delegate Riley, you have your hand up. Did you have an additional
Yeah,
question?
the only thing, I heard what you said, but as I'm reading this, I think it kind of still encourages the process or the use of fetal tissue, opposed to some of the animals that we're currently using. Would you agree with that? Is that?
No, so
No?
you're asking what the alternatives are to using human tissue or animal tissue?
Mm.
And it's not, fetal tissue is not the model,
Right, okay.
okay? So I think that's a misunderstanding, and now we can look that up really quickly, but I know that based on, if you may recall, a couple of years ago, I introduced and we passed legislation to prohibit the use of animals
Mhm.
and research, and then eventually it would taper out. And what I found out in researching that is there are lots of models that are available that use not stem cells, but other kinds of substrates, and in some cases even AI systems or nanosystems and things like that. But it's not animals or stem cells or human stem cells. That's not the choice.
Another question, I guess, just might, and so Planned Parenthood currently, obviously,
Yeah.
they do, legal abortions. So you talked about certain parts of who can donate and who cannot. Do we get any fetal tissue or for stem cell research directly from Planned Parenthood?
I have no idea, and this bill
Okay.
doesn't speak to that. I mean, in other
Okay.
words, if we do, this bill wouldn't change that.
Right. Okay. All
Okay,
right, thank you.
all right. And so let me read this. There's something called organ on a chip technology, where tiny devices containing human cells mimic the structure and function. There's silicon models. So there are others, and you can kind of look that up. But I think the main point here is that this bill doesn't change whatever research models we currently use. It just encourages that we continue to fund the models that are there, and where possible, lean into moving further and further away from animal and human tissue models. And I think you would count stem cells as human tissue models. Okay, that's my understanding. Chris, do you have anything to add or to correct about what I just said?
I don't have anything to add or correct. I think that, like I said before, I just think that there are other alternatives to human embryo or human stem cell research that we just aren't considering because we just we don't have the expertise to know about all the different ones.
And
And
I'm
I
gonna,
don't think that this bill is focused on one of those. It's focused on maybe all of them together.
okay. And I would also like to add that human stem cells and human embryos are not the same. So for instance, we can harvest stem cells from fat cells. So when someone has liposuction, that tissue can be used to get stem cells. And there are other sources of stem cells. So please don't equate stem cell and fetal tissue or stem cell. And yeah, they're not equivalent. They're not interchangeable. Okay, so there are other sources besides fetal tissue. Okay, any further discussion on that bill?
Move the bill.
I think we moved the bill.
Okay, is there a second? Delegate Kaufman moved the bill. Is there a second?
Second.
Okay, let's revote this bill, and these people have more understanding when they vote. So, all in favor of the moving the bill favorably, raise your hand.
Aye.
Aye. Okay, I've got Alston, Martinez, Kaufman, Warman, and Hill, and all opposed. Okay, I've got is that your hand up, Teresa? Okay, and so I've got Hutchinson and Riley. And so the bill passes, what is that, 5-2? Is that correct?
Yes.
Okay, let's go on to Delegate Woods. Delegate Woods, HB 181, can you give us an update? Where are we?
Good morning, Madam Chair. Good morning, members of the committee. Thank you so much. We just want to let you know that we actually have a meeting tomorrow with the Restaurant Association as well as the Retail Alliance to entertain some proposed amendments, and that we have one amendment that we're going to add. We had put in an amendment with the definition of restaurant defined. We used it from the Maryland Code, alcoholic beverages and cannabis. We're going to take out the Maryland Code, however, utilize the definition. And it should read, in this subtitle, restaurant means a business establishment, 1, that is for the accommodation of the public, 2, that has a proper and an adequate dining room and sufficient facilities for preparing and serving meals, 3, that has been approved by the board, and 4, whose average of annual receipts from the sale of food comprises at least 25% of the average receipts of the business. Or do we need that last one?
Okay,
We don't technically need the last one, but we are going to, I think we can take out, because this is really specific to alcohol. We're going to take out number 4. So these are the amendments we're prepared to make. Those 1 through 3, accommodation of the public, dining room facilities, sufficient facilities for preparing and serving meals, and it has been approved by the board.
okay.
All right.
right.
And again, we will be meeting with the Restaurants Association and Retail Alliance to entertain some proposed amendments that they want to make to the bill.
Okay, and
you.
do any of the members have, Delegate Hutchinson has his hand up, Delegate Hutchinson?
Yeah, thank you, Madam Chair. So I actually have taken a special interest in this bill because I've seen firsthand of the dynamics of having the food allergy czar by having Delegate Woods at my home and understanding the significance of this. I had an excellent conversation with Alexa Jordan on the phone on Friday to understand the bill further. Then subsequently, we've had a follow-up with Melvin Thompson from the Restaurant Association. But interestingly, last night on the House floor, as we were leaving, Delegate Woods and I had a further conversation about this. And I have to tell you, Chair, when you closed out last week's meeting and said, I'm having a hard time understanding the burden of this, I think we have somehow made this bill more difficult than it actually is, according to what I talked to with Delegate Woods yesterday. I'm going to try to see if I can join that meeting tomorrow. Delegate Woods invited me to join just to hear that out, and hopefully I think it can get worked out that we can bring this back to the committee.
I very much appreciate that, Delegate Hutchinson. So hopefully by next week we'll be good to go. And I think I think that would be great. Thank you. Thank you for your time, Delegate Woods and Delegate Hutchinson.
Thank you all.
For doing that extra work.
Appreciate you so much. Thank you. Bye-bye.
Okay. All right. So Delegate Patterson is not here, but Chris, can you go ahead and present House Bill 178 so that we can all be reminded of it?
This bill requires the Maryland Department of Health to establish 3 specialized clinics dedicated to the management and treatment of sickle cell disease, 1 in Montgomery County, 1 in Harford County, and 1 on the Eastern Shore. For fiscal year 2028, the governor must include $6,138,000 in the annual budget to support clinic operations, staffing, training, and social support services. By December 1st each year, MDH must report on the specialized clinics to the General Assembly. MDH must establish a scholarship program for medical residents who choose to specialize in classical hematology with a focus on sickle cell disease care.
Okay, thank you. So first, I'm going to ask the members, were there anything that was brought up separate from the fiscal note? Were there any things that were brought up in the hearing that either piqued your interest in looking for a way to move this along, or have you feeling that this is not something we should be spending much time on? Or any questions about the bill?
I think,
And I see no. Okay, Delegate Kaufman, no? Did you,
yes, I had something.
please?
Um, I just, the fiscal note's an issue, Madam Chair, but I think sickle cell is a terrible disease and was just moved by the hearing, what I heard about it. Obviously, I'm not an expert in it, but I think that obviously we can't really move the bill with the fiscal note. But I think at some point, someday, this committee, I've only been on it for a year, but we should continue to work on sickle cell because it's a very debilitating disease. And so I'd like to be able to do something.
Thank you. Anybody else have any comments to make? Okay, well, let me just share with you what my notes were on the bill. To Delegate Kaufman's point, this is a serious disease, and for many years, the research wasn't happening. In the last few years, we've moved from having medications that were very effective in treating or preventing crises that too many people in the state didn't have access to, and too many medical providers knew nothing about. We're now at the point where they are doing stem cell transplants that can cure people of sickle cell for life. And I don't think people know about that. Delegate Hutchinson, you wanted to say something?
Yeah, I just wanted to also comment because I understand the significance of this disease, and I think there's another bill that Delegate Patterson had where we were looking at potentially a clinic on the Eastern Shore. I've actually since found out that there's a possibility for some funding for that through grant funding. I'm supportive of us trying to figure out a solution here, but obviously in terms of this bill, the fiscal note would not allow us to proceed forward with it.
Thank you for that. And I think you're bringing up the other point I was going to make about the hearing is that it was pretty clear that we don't have a picture of what the landscape looks like in Maryland. We don't know who's treating, who's not treating, who's educated. We don't know. So if it is, I'm interested in whether members would be supportive of my going to the chair and suggesting that she set up a summer work group to look at sickle cell, its prevalence, how it's being treated, where the centers are, what resources are available, both for, educating the practitioners about treatment availability and come back with some recommendations about how we might help Marylanders get equitable treatment on this disease. Delegate Rowley?
Thank you, Madam Chair. I do appreciate what you're suggesting. However, I know since I've been here as an elected official, I know that I believe there's already a sickle cell commission or a board of some sort over the years. And so I would like to, I like your suggestion, but maybe we could use the current board to see, an update on what they've done, what they're, they may have some of this information instead of creating a new one. I forget what year it was, but I know we've done something as part of the legislature over the years for sickle cell, and there is some type of board. So maybe use that same resource, or if we have to create, but let's look at that and see if we need to, either expand it or expand maybe, their obligations of what they have to come back and report to us.
Okay.
I was really excited that Harford County was in that bill. But again, the fiscal note is huge because we do have a huge population in Harford County that does have this disease, and they were right along with us. That's how I know that we have some kind of sickle cell board or commission currently.
Okay.
So I would like to see what they've done over the years and then, maybe work off of that.
Okay, thank
So,
you. Chris, can you elucidate us a little bit here?
So Delegate Riley is speaking to the statewide steering committee on sickle cell disease. It includes local national groups that advocate for individuals with the disease, interest and support groups for people with the disease, community groups, consumer groups, academic and private clinical settings with knowledge for caring with people with sickle cell disease, hospitals, pediatric clinics, and their role is to establish institution and community partnerships, establish a statewide network of stakeholders who care for individuals with the disease, educate individuals on the disease, the public, healthcare providers about options for care, and identify funding sources for implementing or supporting the action studies, policies, regulations, or laws recommended by the steering committee, including funding from the state, federal, local government sources, and private sources. And that's
Okay,
all in statute already.
okay, and I don't remember I'm trying to look real quick, but I don't remember if they gave testimony on this bill or not. But what do you all suggest that we should ask for a briefing from them and a report, and then ask the chair to consider whether a work group is indicated to work with them, or what would you all suggest we do, knowing that that group exists? Any recommendations?
I would recommend at least we reach out to them to see what they have done, and what they're going to do, if anything, or if they've, come across, maybe a block of
Okay.
what I know probably they're going to need funding. But I think it's worthwhile listening to them and see what they have to say and then move forward. And if we have to expand on it or change it, then that's what I think we should do.
Okay, now
To
we did hear
continue,
from the Sickle Cell
obviously.
Coalition of Maryland. We had oral testimony, but that's not the group that you're
Right.
talking
Yeah,
about,
because
correct?
this group was established by the Maryland General Assembly somewhere along the line.
Okay.
So
All
I
right.
think we should hear from them.
Okay, so we don't have to take a vote, but is that a general consensus for the group? Okay, no objection?
Yes,
All
that's
right,
fine.
Okay, I'll speak. And what was the name again, Chris?
The statewide steering committee on sickle cell disease.
All right, thank you very much. We will do something with that. Thank you all so much.
And if it helps, it is it's in MDH, and it's in the Office of Children and Youth with Specific Healthcare Needs.
Okay,
That's the office.
all right. And we do have Harrison Palmer here. Oh, no, this is from MDA, sorry. Are you here to speak on a bill?
No, ma'am, just listening in,
Okay.
and then we can weigh in on 625 if it comes up today.
Okay, well, we've already oh, right, we're going on to 625. We already discussed it, we voted it out. Thank you.
Excellent. Thank
All
you very
right. Okay, thank you all. And with that, I'll entertain a motion to adjourn.
So moved.
Move.
Second.
Okay, that was a second and a first on top of each other. Ciao, Bella. Thank you all.